I think I'm going to start now. People will start trickling in. I've got a bit of an introduction anyway. So if that's all right with you guys, I'm going to begin. Okay, so yeah, so today I'm basically going to be talking to you about the dental interviews that you guys will probably be having in a couple of months' time. Just in terms of the whole process of dentistry. Right now, you guys have probably done your UCATs, preparing your personal statements. We'll be sending them off soon. And, you know, hopefully quite soon, you'll also start be getting your interview offers. Just so you guys can have a bit of an understanding of the timeline. My first interview was in December, beginning of December, and the rest sort of followed suit, you know, after that. So you'll probably be getting your interviews, like your interview offers in the coming months, in terms of like the timeline and things. Of course, little plug here. I've just got my Instagram, TikTok, YouTube. You guys can check them out anytime. I have them all linked at the end as well. Okay, cool. So yeah, a bit about myself. Let me move this because I can't see the chat. Cool. Yeah, just a little bit about myself. So I'm currently a third-year dental student at King's College London, the best dental school. I'm actually originally Egyptian, born in Egypt, and came in when I was quite young. Liverpool supporter, of course. Yes, let's go, my guy Adam. And just in terms of like my secondary school education, if you guys are interested, I went to a grammar school in Essex, and then I transferred to a sixth form in East London to do my A levels and my EPQ. So yeah, that's just a bit about myself. And yeah, obviously just now doing dentistry and living my best life. Not really, but yeah, cool. One of the most common things that I got, oh, actually just real quick. So throughout this session, I'm going to be asking you guys questions related to the interviews. So like some interview style questions, like some ethical scenarios, role plays, stuff like that. So do feel free to contribute by the voice chat, or if you're a bit nervous, it's okay. You can write down in the chat some answers. But yeah, just feel free to answer if you want to, because it's basically free practice for your interviews. And trust me, like my top tip is to make sure that you practice as much as possible. So, you know, don't be too nervous if I do ask a question. And yeah, cool. Oops. Okay. So yeah, so as I said, so when I sent out that Google form, the most common question I got was, what is the real difference between MMIs and panel interviews? And simply put, the big difference is that one of them, you're at these like bays over here where you have one interviewer and it's just you being interviewed by them for, you know, roughly, it's usually like 5 to 10 minutes. And you'll do this at different stations. So for your first station, you might be told to analyze an ethical scenario. You'd answer that for 5 minutes. Your interviewer would assess you. Then you'd get up and move to the next cubicle. It's kind of like a rail system that you'd go to the next station. Then you'd get asked another question. So maybe they'd ask you, what skills does a dentist need? What skills does a dentist need to, you know, be successful, for example? So that'd be another station, and then it would follow suit. On top of that, you'll be having like a whole day where you have a lot of other interviewees, and you might like you'll see them about, because you guys always rotate. So it's not just going to be you in this massive empty room. Don't worry. And sometimes it can get quite loud because, you know, like it's like that classic medical thing where it's trying to simulate a ward. You can say like they might ask you a question saying, why do you think we've put you in this LMI situation? And you could say it would simulate like a busy day at practice or in an NHS placement at a hospital, such as guys. So, you know, there you go, some quick answers for you. With the panel, it's more of a traditional style of interview. So these are kind of being phased out a bit more. I know a few universities still do them. My Queen Mary interview in London was actually a panel interview. And yes, Georgina, you have raised your hand. Do you have a question?
Hi, can you hear me?
Yes, I can hear you, yes.
Since interviews are occurring online, how will MMIs take place?
Well, don't worry, I've covered that in...
Oh, okay.
Yeah, there you go. Sorry, I'll go over that.
Okay, thank you.
No worries. Okay, yeah, so back to what I was saying. So with a panel interview, it's more of a traditional style of interview where you would have an interviewer, like you'd have 4 different interviewers. One might be a dental professional, like a dentist. One might be a researcher related to, you know, like some dental topics like caries or saliva, everyone's favorite topic. And the others are usually like 4th-year dental students or older dental students that have volunteered to get involved in the interview process. So yeah, kind of got it summed up here. Some key things to note is neither of them is easier than the other. So I personally found that both the MMI and panel interviews were quite enjoyable if you know what to talk about. However, at the end of the day, it depends which interview you get, because some people can have had some horror stories with interviewers. I've had a couple myself. But overall, like, they're quite pleasant experiences, and most of the interviewers that assess you are quite kind and quite understanding of the situation you're in. So don't be too stressed out. If you've prepared for your interviews, I'm telling you now, they are not as daunting as you might think. And yeah, one key thing to take a note of is with panel interviews, a lot of the time they'll use your personal statement and use that to kind of springboard some ideas to ask you questions. So for my Queen Mary interview, they asked me questions about like some extracurricular activities I mentioned in my personal statement, and they really quizzed me to make sure like it wasn't a lie. So I remember someone DM'd me like a couple of weeks ago. I was like, oh, so is it okay to lie on my personal statement? You might get away with it, but at the same time, you might also get penalized if you go to like one of these interviews and they really like dig into it. So yeah, another good thing about panel interviews is that you can kind of guide the flow of the conversation. So if you're quite a confident individual who likes to talk a lot, doesn't know when to shut up, basically myself, you'll really like panel interviews because you get to guide the conversation, and if you get along with the interviewers, it can be quite a pleasant experience. So yeah, so that's that on MMI and panel interviews. Again, if you guys have any questions, just type them up in the chat, like related to anything that I say. Don't feel nervous, I'll answer them straight away. So yeah, and here are some of the common question types you would probably be asked in your dental interviews. Now, I know this seems quite daunting, and I know there's a lot of content here. However, I'll be covering most of like the heavy hitters today. So going over like role plays, ethical scenarios, key skills, analyzing images, talking about manual dexterity, why then, like I'll be going through this today. So don't worry too much. But the main thing I will say for your interviews when it comes to answering questions is to ensure that, number one, you've practiced a lot, and number two, you're just try and be as calm as possible, because a lot of the time people get caught up in the moment and get really stressed out, and even if they've done all the practice in the world, everything just goes out straight out of their head. So trying to keep a level head is a really important skill that you have to develop when it comes to interviewing, and coming across as confident and articulate are two very, very essential things that ensure that you stand out from the other candidates on the day. So I'm just reading Harris's question here. He's asked, is it only one question scenario per station? I'm guessing this is for MMIs. And would you say it's more like a conversation back and forth at MMI? Okay, so answering the first question, yes. So generally at MMIs, they will ask you one like base question. So for example, they'll say, this is a common one, like what skills does a dentist need to be successful? So I talk about, let's say, leadership. I talk about communication skills, critical thinking. However, they may then follow up from that question and ask you, okay, when have you shown these skills in your own life? Or they may say something else, and they might say, why do you think these skills are important? So yes, normally it's a base question, and they build up on that. At some universities, it is different though. Some do have like two questions in one, and you just have to answer it in the time that's given. At the end of the day, the interviewer and yourself are the ones that control the flow of the conversation, and you have to think of an interview as a conversation sometimes. And that's how the questions are asked. So they have a set of questions that, they could potentially ask you, but there's extra like hidden questions that come up based on how the conversation flows. And would you say it's more like a conversation back and forth? Yes, as I said, like it's like a conversation. I'd say panel interviews feel more like a conversation because you're with the same four people for about 20 odd minutes. So you really do get quite a good flow when it comes to the interview itself. However, as a whole, interviews in general should just feel quite natural and come like straight out of you, like you're having a conversation. That's kind of when you know it's going well, even though that's not the sole indicator of how well you're doing. So yeah, hope that answered your question. How will COVID affect interviews and some interview tips? So I had a little look online. There's not that much information out there, unfortunately, because that's the time we live in. How will we be interviews? I'll answer that now, don't worry. I'm assuming like these are based on my assumptions. I'll try and like stay up to date with this and update you on my Instagram and stuff like this if anything changes. But I'm assuming there'll just be some online, like they'll do online interviews. In the same way, like if any of you have had any jobs like just remote interviews like over the phone or sometimes on like a Skype call, I'm pretty sure that's what will happen with some of these dental interviews. And you'd still be able to do MMI stations, I believe. But maybe you'd have to just change the call. As I said, unfortunately, I don't have access to that information. I'm going to try and keep up to date. I'm unfortunately just as unsure as you guys. But I'd still assume that they would find a way to keep the same sort of format when it comes to the questions. And if not, then we'd be going towards a more, traditional style of interview where you have just a specific interviewer just asking you questions throughout. So I hope that answered your question, Salise. And I'm sorry, I can't read your name, but it says, are there literacy and numeracy tests after the King's interview? I don't think so. No, we don't. I don't. What do you mean by literacy and numeracy tests? Yeah. No worries. Yeah, no, I don't think there aren't any, like, there's no extra tests you have to do for Kings. The only exams you have to do to enter your King's interview is your UCAT and to do your A levels and, like, obviously your GCSEs or whatever higher education you've done. However, there's no extra tests you'd have to do after, no. So don't worry about that at all. So yeah, just back to this. I just thought I'd go over some, like, key interview things that you should take into account. Make sure you dress well and look professional, and behave the same way you would in, like, a, you know, like a proper, like, if you were getting an interview for a job. So be very professional, very respectful to the person interviewing you. And trust me, a good suit or, like, just being well dressed goes a long way, because first impressions last. So really make sure that you're going there with the intention to, you know, look professional, and you're, like, selling your image to the interviewer, the person assisting you. And articulation is a very key thing as well. A lot of people have this misconception that if you talk a lot, something within that waffle will be related. So, you know, the interviewer will say, oh, they kind of know what they're talking about. It's actually the opposite. If you can be short and concise and answer a question well, an interviewer will be more impressed by that than anything else. And again, Sally says, on the website, you have to sit numeracy and literacy test. Okay, I've never heard of this before. I'll have a look at this. Let me take a note of that, actually. If that's the case, then this is something new that's been added this year. Let me take note of this. So if you guys could just quickly, like, if you guys have a link to where it says this, that'd be great. And I'll have a look at it straight after this session. Leeds, how many MI stations are there? I am not too sure. I didn't have an interview at Leeds, unfortunately, sorry. So King's, literacy, and numeracy tests. I'll have a look into that, guys. Yeah, okay, cool. That's fine. And yeah, and try and look at the interview. So one thing is, like, keeping eye contact. And also, I'm going to answer the question about how do you answer questions you don't know the answer to. But yeah, just make sure you keep eye contact with the interviewer. This doesn't mean stare at the interviewer the whole time, by the way, because a lot of people do this thing where they're like, hello, today I'm going to, you know, this is the answer to this question. Don't do that. Just have some eye contact when you're actually answering the question. When you're listening, you don't always have to be staring at them. You can be looking, thinking, answering, like, just be natural. But eye contact shows, like, confidence, and it shows that you're really taking into account what the interviewer is saying. Okay, cool. So Mohammed apparently is saying it's for Dent. It's not for Dent, it's for nothing. As I said, I've never heard of this literacy and numeracy test thing, like, ever. And I know a few people that have applied, like, for the last few years, and this has never been a thing. As I said, it might be added new because of the COVID situation, but I don't think it's a thing. But I will check for you guys. Don't worry about that. So yeah. And Milan, with regards to the how to answer questions you don't have an answer to, as I said, I'll go through that later today in this session. Cool. Again, if you guys have any questions, just keep them coming. I'll answer anytime. So here is a nice little technique for you guys to answer questions. If you're not very confident, because a lot of people were messaging me, they were like, you know, I'm not the most confident speaker. I don't really know how to structure my answers. This is, like, you know, the best template you can use. So it's called STAR. You've probably seen it on some websites like the Medic Portal and stuff like that, but I've added an extra R here because I think this is very important. And simply put, STAR makes your answers more fluid, and it also makes them more structured. So you have, like, we're preventing waffle, basically. Like, this is the biggest, like, if you don't learn anything today, learn one thing. Don't waffle in your interview. Just get straight to the point. They really don't like waffle. And also, you don't have that much time. Like, you have like you usually have like 5 minutes per station, and on average you have 5 to 10 minutes. And on average you have 5 to 10 stations at every interview. And sorry, I just saw your message, Zara. What uni did I apply to? I applied to King's College London, Queen Mary's University London, Sheffield, and Bristol University. They were the 4 I applied to. So yeah, so let's go through STAR very quickly. So STAR, here we have a situation. So this is where you state a personal example. So you can say, for example, I'm going to kind of steal an example I have later, but yeah, I was house captain on my 6th form, for example. Task, you talk about what you did. Action, how you did that task. Result, basically what happened as a result of your action. And then after this, the most important point I'd probably say is reflection, because it's all well and good that you did these amazing things. You volunteered at this care home. You learned, like, you did this and that. But if you don't actually understand, the things that you learned from it, it's absolutely useless, because everyone has the ability to, go out there and work and develop all these skills. But have you really learned, and have you really applied that to your personal life? And that's a key thing that you need to ask yourself about all the, like, some things that you've done in your life with regards to boosting your application. Can you really apply them, and are they actually viable things that you care about? And the last one is to relate it to dentistry. So if you can, I'm not saying always do this, but if you can, try and make a link back to dentistry, because obviously all these questions they're asking you are related to dentistry anyway. So they're trying to see if you're able to grasp the point of the question. They might ask you something very random, like there's these random questions where they'll ask you to look at an image and describe the image. And the reason they do this isn't because they want to waste your time and see if you can describe an image. It's because they're assessing if you have the ability to pick out fine details. And specifically speaking, there's these images called X-rays or radiographs, you have to call them now, and dentists have to take them all the time. And one of the key skills you have to have is identifying these very small structures and very small color changes. So being able to describe an image shows the ability, the fact that you have the skill to identify these small structures, and it's applicable to dentistry in that way. So there you go. That's a nice little answer for you for your interviews, because 99% chance you'll probably be asked that at one of your 4 interviews if you get all 4. So yeah, so I thought I'd give you guys a question and answer model. So this is a model question and answer. So this is something that either I was asked or someone I know was asked at their interview, and this is how I would answer it. So yeah, so the question here is, tell me a situation where you showed leadership skills, English. So the situation, again, I was house captain at sixth form. Task, I led my team in organizing the school quiz. Action, I delegated tasks to all members in the team to effectively time manage and communicate with other house captains to ensure they were given sufficient information to organize their events. Now, do you see here how, even though it's asking about leadership, I'm still like making these links with other important skills like time management and communication. I've not made it very obvious, and I've not made it super clear. Like I've just made it very natural in the answer. If you can develop that skill, and which is to talk about, like, link different topics together, it really, really, really will help you in your interviews, because fluidity and, again, I'm going to say it, lack of waffle is very, very important. So this is a good thing to get used to, is trying to link things together that have some relationship and are related together. Cool. The next one is the result. So as a result of my delegation and my teamwork, my team's work, my team and I managed to hold a fun and engaging quiz at the sixth form within the allocated time given by the school. Again, keynote, I mentioned the allocated time given by the school because, again, I'm pushing on this idea of time management. I'm showing that I've taken into account that time management is an important skill to have. And then reflection, which I personally think these last 2 R's, in my opinion, are the 2 most important R's. So reflection, I've now learned how to think critically, take important decisions, and this has led me to have an increased level of productivity in my team and a favorable outcome of a successful event. One key thing here is, because, it's something a lot of people fall into, is forget about this whole, it's, I, me. It's all about the teamwork that you have, and it's all about the people that helped you along to achieve the result that you did. A lot of the time people get asked these questions about very personal questions, and they come across as quite arrogant, because they try and make everything about them. Like, oh, I'm an amazing leader because of this. I'm an amazing leader because of this. You're not. It's because of the fact that you worked within a team, and because you have, of course, you're an important member because you're the leader in this situation. However, you need to take into account that it's not just you that's important, and it's not just all up to you that you did well or that you achieved this goal. It's a joint effort. So yeah, make sure that you give credit to a person. And if you haven't worked in a team situation, and let's say you've got a very personal example, or it was just you, that's fine. There's always someone in the process of you achieving something that helped you out. For example, let's say you did well in like a science competition, you might be like, oh no, it's just my own intelligence. Or no, you can talk about the teachers that helped you out. You can talk about the resources that you use. You can talk about like some channel that you use or whatever. Just make it clear that you understand that not everything goes just to you. You've had assistance, and you can appreciate that, you can't get through dentistry without the help of others. And trust me, you'll realize that very quickly, that without your nurses, without your technicians, without your but without everyone else in the dental team, dentists are absolutely useless. So yeah, just keep that in mind. And the last thing is to relate to dentistry. So again, I'm going back to the root of the question. So I'm mentioning these leadership skills. So that's another good thing, is just to wrap everything up, use the words that were given in the question. You say, these leadership skills are essential in dentistry, as in must be competent in leading and delegating tasks to a multidisciplinary team. Little top tip, use this terminology. They really like when you talk about multidisciplinary team, because it shows that you understand that there's every single person in that team has their own specialty and has their own needs, and every cog is different in the machine. So yeah, in this situation now, I'd like to ask you guys a question, if any of you is brave enough to answer. So the question will, I'll type up in the chat. So the question will be, tell me a situation there we go. So question is, tell me a situation where you showed effective communication skills. If anyone of you wants to answer on the voice chat, go ahead. I'll give you a couple seconds to give it a think. Don't worry, I'll help you out along the way if you want me to. And I'll give you some feedback at the end, or at the end of you answering the question. Let's see if anyone is brave enough to do it. All right, I'm assuming not. That's completely fine. I have one. I was in Alicante, my friend was. How do you raise your hand? I don't know. There should be a button at the bottom that allows you to raise your hand. If not, you can just unmute yourself, and if you want to answer, you can unmute yourself and just talk.
I want to answer, but I don't know if you can hear me.
I can hear you. I can hear you fine.
All right. So what was the question? Communication skills.
Yes. So the specific question is: tell me a situation where you showed effective communication skills, or just communication skills.
A time I showed effective communication skills was when I was volunteering in a dementia care home. So we used to go there, and we used to sit down and talk to the elderly patients who never had a lot of visits from their family. So we spent a lot of time getting to know them and their habits and whatnot. But we also knew that they have like fragmented memories. So your choice of words needed to be very specific, as well as your tone, in order to, you know, have accurate conversations with them. So there was one lady that I was with, and she used to cry a lot because none of her family members used to visit her. And she was, you know, becoming, it was like not a bad influence, but it was like a very sad state around other people. So in this situation, I realized that she was, you know, becoming detrimental to others. And I used my communication skills, plus my like memory of the patient. I knew that we had an inside joke with my friend that we used to like, you know, just talk about his hair because he had like really big curly hair, and we used to laugh at it. So I just like kept talking about that, and it switched her mood, and she stopped crying, and she got into a better state, and everyone else around her, their moods were lifted as well. And this probably taught me the importance of recognizing the danger in the situation, but also your tone and your choice of words, but also perseverance, because she wouldn't have known what I was saying the first time, because she would have been in like a hysterical state. And this is probably important in dentistry. For example, when you're dealing with an anxious patient and like a younger child who's like really scared. Yeah, that's basically it.
Nice. Yeah, I think that was quite well answered, actually. Nice, well done. Thank you for being the bravest one in the group and answering the question. I think overall you answered that quite well, of course, because you were quite on the spot as well. So sorry about that. You related to dentistry, which I think was very good. You talked about the action that you took, about the task. One thing I would say is you mentioned like tone, like your tone of voice and how that's an important thing, but try and mention that a bit earlier on, because there were some parts where I felt there was a bit of rambling on and you were kind of not getting to the point. But overall, I definitely think that was a good answer. The best thing you probably did was made sure that you related to dentistry and that you sounded quite confident and you were quite articulate as you were speaking through. So just so you guys also know, I will answer this, Zara, in just 1 second. Just so you guys know, so in this situation with Mohammed, so he's just answered this question. As an interviewer, I might then press on with him and ask him some more questions. So I could ask him something like, okay, tell me a situation in dentistry where you think communication is very important. Or tell me a situation in your work experience where you saw a dentist show effective communication skills, or something like that. So bear in mind that even though he's answered the question and he answered it quite well, it doesn't mean that the questions stop there. They can still keep coming, and they can still keep asking you follow-up questions as a result of this. But yeah, thank you very much, Mohammed, for answering. I will go to the next slide now and answer you, Zara. So Zara Ibrahim says, how are you supposed to stretch the answer out for 6 to 7 minutes, as I find I run out of what to say? I think I know I said what they want. Yeah, that's good, actually. That's actually quite a good thing. I don't think at any of the stations I run out of time. And that was merely because of the fact that when I answered the question, I answered it, I gave exactly what I needed, and I was confident in my answer. I know I've hit every nail on the head. So if you've done that and you know that you've answered the question well, it's okay. Then you'll say, that's my answer, and that's what I think I would do in that situation. And then they'd ask you follow-up questions. Don't worry, the interviewers are prepared for this. Like, they know that this is what's meant to happen. Some interviewers will stay silent, and that's completely fine. You can continue speaking and you cannot. What they sometimes do is they'll stay silent until you say you've finished, to see if you have the ability to say that, or if you're, too shy to do so. So that's one thing to take in mind. I hope you guys, yeah, hold on, I'm just going to restart this camera. Can you guys, yeah, you guys can still see me, right? Cool. Yeah, so that's what they'll be looking for. They'll be looking for a person that can get straight to the point and is confident enough to know, okay, I know I've mentioned everything I need to mention, and I know that overall, this answer is more than competent and more than enough. So yeah, so don't worry about filling the time. That's the wrong way of thinking. Don't think of filling the time. Think of answering the question to the best of your ability and waiting for the interviewer to build up on, the content that you've provided them. Because bear in mind, they know nothing about you. They're learning about your mannerisms. They're learning about your professionalism. They're learning about the way you communicate through the way you answer the question. And one way to show confidence and to show that you understand the question is by answering just what's being asked and not going and waffling and talking about some other rubbish. So yeah, hope that answers your question. Is talking too much a negative, like talking over 8 minutes? Well, if you talk over the time limit, they'll just tell you to leave. Like, no, not in a mean way, as in, you have a certain time that you have to speak in. If you try and talk over that time, well, you've talked over that time. That's not a good thing, of course. You need to talk within that time limit. Obviously, sometimes you might have a conversation with the interviewer. Like, one of my interviews was like a 4th year dental student, and I answered the question. I'd finished. I'd said everything that could be said. They even asked me some bonus questions. And they just told me, yeah, that's all the questions I have. And we just had a chat about life. So I said, like, these interviews aren't, some of them aren't super serious. Like, they're quite chill. And as long as you've answered, that's all you need to do. But yeah, talking too much, I personally think is a negative. But that doesn't mean you shouldn't be detailed. Don't mix those two things up. Talking too much is when a person goes over the limit and talks about irrelevant content. But talking with detail is when someone mentions things in a manner that, gives the interviewer a clearer image. So try and, separate those two things, because it's a very important skill to have. Do you make small talk with the interviewer at the MMI? Only make small talk if you want to make small talk. Like, don't force it. Don't think, oh, I need to impress this interviewer. They don't care about you. Like, they're going to see hundreds of interviewees. So have the small talk if you want, but don't think you have to talk to the interviewer if you don't feel like it. And most of the time, if an interviewer doesn't want to talk to you, they'll just keep asking you questions. So, it's not really a situation you have to worry about. Do the interviewers expect you to ask questions at the end of each station? No, they don't. No, not really. I might have asked maybe 1 or 2 questions like to interviewers, and they were literally just small talk. I never really asked like, oh, so what type of research do you do here? Like, you can ask questions if you want, but you don't have to. It's not, I don't think it's anything that differentiates you from anyone else. Unless they ask you, do you have any questions? That's when you might want to have some questions lined up. That's the only situation where I'd say maybe have some questions lined up for them. What if you can't say much? Well, that's fine. It's similar to what do you do when you don't know how to answer the question. I was going to answer it later, but I guess this is a common thing that a few people have said. So what happens is, let's say you've answered the question and there's not really much you've said. That's fine. If the interviewer thinks you haven't said enough, they will ask you follow-up questions to get more information out of you. So it's part of their job to do that. Some interviewers won't. And again, it's just part of the game. Like, some interviewers are nicer than others. Some will try and get more information out of you than others. It's just how lucky you are. And let's say you don't know what to say, it's fine. Just tell the interviewer, I don't quite understand the question. I had this exact situation at King's. I had a question that was asked by my interviewer, and I thought they were speaking another language. I didn't understand the question. So I literally just said, I'm really sorry. I'm not too sure what you're talking about. could you please explain the question a bit more? And then the interviewer was very polite, and they're like, yeah, of course. They explained the term to me, and I was like, okay, fantastic. The term was CPD. It's called, it was like, was it continuous professional development? I can't remember. It's like this extra training that you need to do as a dentist, because obviously dentist is a lifelong, teaching career. You always have to be learning new things on top of research, etc. So they were asking me this question. I wasn't too sure what they meant. But based on that, I managed to build my answer. So yeah. Okay, we've got a lot of questions here. So yeah, that's kind of what you do when you can't say much. You try and say as much as you can, and you can use the interview to get some verbal and non-verbal cues to see if they can give you some more follow-up questions, or get them just to explain the question a bit more. It's completely fine. So I hope that answered your question, Haja. Mohammed, what dental schools did you get offers from? So I got interviews from all my dental schools, so from Bristol, King's, Queen Mary's, and Sheffield. I got offers from 3 because I got them all quite early, so I just rejected Sheffield. So I never really wanted to go Sheffield. So yeah. So once I got my 3 offers, I just said safe. So yeah. What time is this expected to finish? I don't know. I'd say probably in about half hour, maybe a bit longer, depending on what if people have extra questions. What kind of questions can we ask at the end? Any questions you want. Any questions you want, you can ask at the end. Is it always one question per station? I answered this a bit earlier. Most of the time it is one question per station. However, they might add an extra question or 2. And as you have the conversation, they will ask follow-up questions. What were my GCSEs and A-level predicted? My GCSEs, I got 11 A stars. My A-levels, I got 3 A stars, 1 A. 1 A star was an EPQ though, so don't be fooled. If an interviewer asked you a question you didn't prepare for, how can you be spontaneous with your answer? Be spontaneous with your answer. Don't be spontaneous. I don't know why people think spontaneity is a good thing. Ask the interviewer what they mean, and then think about an answer. Don't just think, oh, let me say the first thing that comes to my head. Only when they ask you a weird question. One weird question I got in a practice interview was if you could be any biscuit, what biscuit would you be? In that situation, then maybe be a bit spontaneous. However, apart from that, if they're asking you a normal question, don't be. Just think about your answer and then process and give an answer. That has been well thought out, because the first thing that comes to your mind is never the best thing that comes to your mind. What university am I studying? Which biscuit did you choose? I'll answer. So, which uni am I studying? I am studying at KCL, King's College London. What will a 615.5 average and band 1 get me an offer at King's? I'm not sure. I won't lie to you. It's a bit on the low side. However, depending on the details this year, you can kind of decide whether or not you want to apply. In general, the UCAT is valued quite highly by King's, so might not be your strongest university to apply for. Maybe you should look at universities that don't weight the UCAT super highly, and maybe apply there. Okay, guys, I'm gonna stop you for a second because I do need to get through this presentation. But all these questions are fantastic. Keep them coming through, and I'll answer them once I get a bit more through these presentations. Just keep them coming through, and yeah. And you can ask me more at the end as well, because then most people will be able to go. I just want to get through this. So yeah, so ethical scenario. So the 4 ethical principles. These are more like the medical principles, and these are autonomy, justice, beneficence, and non-maleficence. Beneficence and non-maleficence sound kind of long. They're not really that difficult. Beneficence basically just means make sure that you're benefiting the patient. It's kind of in the name, like beneficence, benefit. And non-maleficence, so malice is being bad to someone, so don't do anything bad to the patient. That's the ways I remember them. And mal is bad in Spanish, I think, so that's another way. Autonomy is just anyone's right to make their own decision. So let's say a patient comes in and they say they don't want to do a treatment, even though it's the best thing for them, and that if they don't do that treatment, they're going to lose all their teeth. There's not really much you can do. You can tell them about all their treatment options. You can tell them what they should do. However, the final decision is with the patient. However much you want to do that treatment, it's not up to you in the end. It's up to the patient. Our job as dentists is to give the information, to give info to these. Sorry, is to give as much information as possible to the patient and let them make the decision. So yeah. When you get an ethical scenario, also make sure you consider both sides of the argument. So a lot of the time you'll be given a situation and you're like, oh, I know the answer, but that's not what they're looking for. They're trying to see you evaluating. That's why I've got these scales here. It's to see, it's your evaluation skills. What do you think is good in this scenario? What do you think is bad? What do you think violates ethical principles? What do you think don't violate? What do you think is on the fence? There's a lot of different things you need to consider when you're answering an ethical question. And it's not as clear cut as like the star example I gave. You can't really use that. You have to really think and apply your knowledge to the specific scenario you've been given. And do not be over emotional. So many people think, oh, in an ethical, oh, I really need to show that I care, show my empathy. you do, but don't overdo it because you'll sound a bit, annoying for the interview. Listen and take time to understand the scenario presented. They are sometimes quite complex. Bear that in mind. Don't rush into it. A lot of the time you'll read like halfway through the ethical scenario, you're like, oh, this is calm. And then you read the last sentence and it changes the scenario completely. So make sure you read everything and you really read it in detail and highlight if you can, write down if you can, whatever you can do. Sometimes they allow you to take a pen into the interview so you can like write on the piece of paper they give you. Sometimes they don't. Take one in and see what the situation is. And yeah, and come up with a fair and balanced conclusion based on your careful evaluation. Think of it as a journey. So as you're having this conversation, you're talking about these different things that you've evaluated. And at the end, you'll say, this is what I think based on X, Y, Z. And observe the GDC principles. You don't need to know these in like absolute detail, but go over them and check them out. They're not a bad thing to, have some knowledge about. You might be asked about them in your interviews. It has happened before. I didn't personally, but I know people that did. So you should know them. The two key things about GDC that is not mentioned within these is confidentiality and informed consent. Very important. That's going to be your homework to research those. So here is a model ethical scenario. This is why I was saying I'm going to answer these questions later because there's a lot of info here. So the ethical scenario is this. You have a 7-year-old child who's come to your practice with multiple decayed teeth. You explain to their mother that you need to do 5 fillings to save the teeth. However, their mother disagrees and says you're scamming her. Dun, dun, dun. How do you approach this scenario? Now, first of all, you might be thinking, how can she disagree with me? Like, I know what I'm talking about. I'm the dentist. Surely, she should respect my professional opinion. However, that's not how it works in the world of dentistry. And if you start thinking like that, you'll be sued within your first 2 years in practice. So don't be too cocky. So yeah, I'll quickly go through this. So first of all, you need to address the concerns of the mother. Bear in mind that she's still the patient, like she's the patient's mother technically, but because the patient is quite young, the mother, takes on the role of a guardian, like a legal guardian parent. So they will take the decisions for the child. So you need to address these issues. You need to find out why she thinks that, you're a scammer. Because she might have had a negative experience in the past. You don't know. You don't make an assumption that this person is inherently bad. You need to understand where they're coming from. So ask her and see what her situation is. And sometimes even just asking and quashing some of these bad assumptions she has of dentists can really change a patient's mindset. So it's an important skill to develop. Next, do not belittle or dismiss the mother's concerns or be offended by them. As I said, this is part of professionalism. This shows your professionalism, and this is a GDC principle. So just thought I'd throw that in there. And absorb the viewpoint of the mother. And by absorb, I mean really, really understand what is Gillick's competence. I'll go over that in a second. And this means really, really go into depth and understand what the mother is feeling and why she has, had this reaction to you. I really understand that. That's part of ethics. It's understanding the mentality of the other person in front of you. You need to really see why they've come to you with, this attitude or this upset. Next, you need to explain the treatment to the mother and why you think it's the best long-term clinical decision. Again, this is showing your professionalism and it's showing your ability to provide information in a clear and concise manner. That's your job as a dentist. And you can also mention alternative treatments. So maybe the mother doesn't want to have fillings. Maybe she thinks the fillings are too expensive. Maybe she thinks fillings are a waste of time. Maybe she thinks fillings are not vegan. I don't know. Some people think like that's how some people think. So you need to give alternative options, but also explain what the long-term consequences are. Don't just give an option and say, yeah, you can do this. Like, for example, you say, oh, I can extract your child's tooth, but, maybe not the best idea. So yeah, so explain the treatment plan. And you must respect the fact that the child is below 18 and informed consent must come from their legal parent or guardian. So Gillick's competence, because I've seen someone mention it in the chat. So Gillick's competence. So this is where, oh, okay, there you go. Thank you, Amira. So that's the answer for you. But just very quickly, with some younger patients, sometimes there's also something called like the Fraser rules, I thought, or the Fraser principles. So let's say a young patient comes in below the age of 18. However, they seem quite competent. They seem quite mature. There's quite a few like criteria they need to fill out. They can actually make a decision on their treatment without a legal guardian or parent. In dentistry, it's not that common because, why would some random 14-year-old just say, oh, I want you to do fillings without my parents knowing? It's more related to like sexual health and stuff like that and contraception. However, it's just something important to know and something you could mention in the interview. But this is actually another tip that I just remembered. Don't mention something you don't know, that you can't articulate on. So don't mention Gillick's competence if you don't really understand what it is. So that's another key tip. Don't mention things just because one of your friends said, or just because I've mentioned it, doesn't mean you need to mention it. It's just something extra there. And then you also have to make sure you respect the mother's autonomy in her decision making for her child. And this is linking those ethical principles. So again, we'll go back to autonomy. That's just knowing that every patient has a right to make their own decision. And because the mother is the parent, she takes responsibility of the child. So you technically treat her as the patient in this situation. And yeah, and that's it. And even though you might think you know the best decision for the child, the final decision is not up to you. Remember that. So yeah, so that's the ethical scenario. I've given you guys some examples to do in your own time. I think at the end I might go through these because I feel like we're running out on time. But if you guys want me to test you on some ethical scenarios at the end, do let me know. Just spam it in the chat and I will make sure I get it done. But yeah, so these are some extra examples for you to do in your own time. I'll send this presentation out to you guys. And here is the dreaded question: why dentistry? So this question is not super common. I'd say out of the 3 interviews I attended, I got asked it once, and it wasn't really direct. It wasn't like, why dentistry, Faris? They just said, they talked about work experience and then it sort of came in. So this is like a little table to tell you the do's and don'ts. I'd say the most important thing is to talk about why you actually want to do dentistry. What makes you passionate about dentistry? If any of you say money, just leave. Because number one, you're not going to be making that much money in the beginning anyway. And number 2, it's a grind. Like there's other jobs where you can get money a lot easier. So just really mention what makes you passionate about dentistry. One thing is not to, as I said, don't mention that you think is a good career. That's the most basic answer under the sun. Everyone says it. And that's why, so many people get rejected because they say answers like this. So don't say that. And do be realistic and weigh up the positives and negatives. A lot of people also try and sugarcoat dentistry. So like, oh, I want to do dentistry because I love the career. It's the best career. Can you say rewarding career? You can say it's a rewarding career, but okay, then let's say I was interviewing right now. I'll tell you, what do you mean by rewarding? Can you define what that means? Can you explain why you think dentistry is a rewarding career? So if you're going to use like a loose term like that, you have to have some information to back it up. Which is why I think it's important to talk about what like individual things that are unique to you, because then if they prod in, if it's honest, like if it's an honest passion, it's very easy to talk about. So yeah, and yeah. And also, don't say this thing where people say, oh, I wanted to be a dentist since I was a child. No, you didn't. No one wants to be a dentist when they're a child. Like, I'm not going to go over that anymore. But yeah, another do is mention how work experience, volunteering, personal experience gave you insight into the world of dentistry. Again, this is building on this unique factor. This is this you factor. No one else is like you. You are an individual that is, unique, and you have your own skill sets and your own passions and your own needs to, as to why you want to do dentistry. So really show that to the interviewer. Show them that you really care. Show them that you really do want to do this career for the next 30, 40 years of your life. Another thing is, don't mention your dental family members. So some people say, oh, and this is fine. Like if your passion really did come from your uncle that does dentistry, or your aunt, or whoever else you have in your family, it's completely fine. But it's not really something unique to talk about. Every person, I'm sure like half the people applying, a lot of them have some distant relative that does dentistry somewhere, but it doesn't make it unique to you. So don't mention things that are generic. There's no point. Obviously, you can throw a few things that are generic here or there just to fill out the conversation if you need some time to think, but in general, don't. Next thing, have a general outline of what you want to say prior to interviews. So this isn't like, some people get confused by this. They think this means that you should plan an answer. I don't think you should plan like a detailed answer, but I think you should have an idea of what things you want to talk about. So have like a really loose plan, like a loose outline, which is why I said outline, like a general outline that goes over like the key things you want to mention. So for example, I'll tell you guys what I like, the notes that I took before I had these interviews. I said stuff like, I want to talk about maxillofacial surgery. So this is a type of surgery that's associated with very, very heavy trauma to the face. So like motorbike accidents, etc., etc. They do a lot of invasive procedures related to like the jaw, related to the head, related to just, something that I find very interesting. Doesn't mean that you'll all find it interesting. You might find it disgusting because it's quite gory, but that's the passion I talked about. I also talked about things like the work experience that I applied to, how I found that quite enjoyable, how I really saw myself in that situation. I talked about how I feel like I'm quite business oriented. I really like to, delve into new things, and I feel like dentistry allows me to explore that more. Of course, it's related to money, but it's not me saying, I'm just doing it for the money. So that's another way. That's like kind of a way you can mention it if you really, really want to mention it. And yeah. And the last thing is, don't waffle and mention 1,000 things. As I said, having that loose outline, make sure you get straight to the point. So I hope this has answered like the why dentistry. If you guys are still confused, it's completely fine. It's not an easy question to answer because it's such a loose question. It's hard to answer. Good things to do again is to follow these do's and not do the don'ts. And also you can relate to your personal experiences. Again, very, very important. Like work experience is a very good one to talk about. You can literally talk about that for like 5-10 minutes. and fill out that interview. And one of my questions was actually just about how work experience, made me want to do dentistry. So there you go. We're going to role play in a second. I'm just going to read some of the more recent questions. What if a young child does not give consent, but the parent does? Do you listen to the parent? Yes, you listen to the parent. In this scenario, the mother wants the teeth extracted, even if you as a dentist know it's not the best, do you still do it? Oh, that's a good question. Okay, I think I exaggerated a bit by saying it's not really a viable option. And most of the time, like when you explain to the patient and you really get down into the details, like they will normally listen to you. Or what you can do is you can say, okay, well, you can have a think about this, and then we'll schedule another session or like another appointment in the future, something like that. So yeah, but yeah, like if they really insisted on it, and like that's that's the clinical diagnosis, then it is what it is. Well, is this when did yeah? Sorry, let's see if there's anything else. Yeah, all these more general questions I will answer at the end, as I said. But yeah, so cool. Okay, role play. Another one. This one's more of a dreaded one. Just something that you guys should know, because I know a lot of people are thinking of applying to King's. King's don't usually test you on role play. I don't know anyone that ever got tested on role play at King's. I don't think they do it as a station. So if you don't like role play, well done. Will they have role play online? Potentially. Is 680 a good UCAT score for King's? Objectively speaking, I'd say yes, but I haven't seen the details that I've looked at the details actually, and I think 680 in general is quite a good. Like you'll be fine for King's. Okay, just really quickly because I'm sure I'm going to get a lot of these. In terms of like your UCAT score and telling me if it's good or not, in general, your UCAT score is not the sole thing that the university looks at. Okay, you need to understand that it's not just that. Like if you got a 750 UCAT or like an 800 UCAT, and your predictors are rubbish, you're not getting into King's, and you're not getting into any university in the country. It doesn't matter. You need to have like the most important things, unfortunately, are like your A-levels. They're like your entry requirement. You have to have those A-level grades. And then it comes to UCAT, and then you have your GCSEs and your personal statement, and then your interviews. So yeah. So don't worry about this idea of like good UCAT. In general, but just to answer you directly, 680, I'd personally say yes, it is a good UCAT, and well done. With role play, yes. So yeah, role play. So these are quite fun. I find them quite fun because I don't like shutting up. And in these situations, basically, you'll have like an actor in front of you. They'll be acting out like a scenario, and you will have to, like carry that scene on and maybe assist them in a certain situation. So sometimes you might be asked a question as, like breaking bad news, or dealing with a hysterical patient, dealing with an angry patient, dealing with someone that you find very annoying. Remember, not all of these will be related to dentistry. These can be like general things. And sometimes also just explaining like a difficult concept. So if you have to explain like a procedure to a patient, or you have to explain like let's say a task to someone that is not used to that task. I'll go into some examples soon because I know that's a bit of a loose statement. Again, not related to dentistry. These can be very random. Bear in mind that a lot of the time will be paid actors, so they will really they'll be really realistic. Like in one of mine, the actors started crying, and they were like really hysterical, and I was like, oh, okay, like this is serious now. And empathy is a very key skill they assess. One thing I also say is don't laugh. Some of the scenarios are like a bit not comical, but they're a bit like, oh, interesting. So try and make sure that you stay like serious, maintain that professionalism, and be empathetic. Okay. And empathy is different to sympathy. Quick question, you can write this in the chat. Does anyone know what the difference between empathy and sympathy is? You can either say it on the voice chat, or you can write it down in the chat box itself.
Yeah, so empathy is when you try to put yourself in the person's shoes and feel what they're feeling, and then sympathy is when you feel sorry for the person and a bit of pity.
Yes, exactly. That is, yeah, exactly. Actually, there's not much more to say. Yeah, so that's a very key thing to understand. So, like, you might be asked a question where they might ask you to explain the difference between empathy and sympathy, and whatever Amira just said there, which was talking about putting yourself in the person's shoes, and sympathy being more like an emotion where you can, just identify that someone's upset and be upset yourself. They're two very separate things. Again, I put this in the PowerPoint itself in the notes section, so you guys can read this in your own time. But really do try and brush up and understand the differences. And in general, just to really make it easy, you want to be empathetic, not sympathetic, as a dentist or as a professional. So that's just if you guys can't be bothered to read up on it. So here are some role play examples. These are quite generic ones. So one is you have to break the news to a patient that their hamster has to have their leg amputated due to complication during surgery. Explain to an 83-year-old person how to book tickets online for currently. I'm not going to read through this. You guys can do this in your own time. Again, I might be going through a role play example at the end and doing that with you if you guys are still here and interested, because I know I'm overrunning slightly. And these are now, I'm going to go into like the more general questions. So this is how to answer questions related to university. Sorry, let me just read this quickly. Are the average UCAT scores for people who are applying for dentistry lower than the average for those applying for med? Not sure. I don't have the official statistics. I'll tell you, like, from what I know, from a lot of people that I know that applied for dentistry, you know, had scores ranging from 620 in the UCAT to like 750. And some people got over 800, but like if you get over 800, you're getting into anyway, so don't worry about that. But yeah, like it's not like there's no specific, you know, representation of who gets higher. Like I know people that did medicine that got much lower than me, and I know people that did dentistry that have done much higher, like that have got much higher than me. So it's quite a variable scheme. That's why I say look at the decels. The decels are the best thing because that's how all the universities look. Like dentistry doesn't just say, I want a lower score. They will just look at, you know, where you're ranked in the country basically, or deciles. Sorry. What's the difference between empathy and compassion? Oh, good question. I'll look into that. You know what? I've never actually thought about that. The difference between empathy and compassion. Good question, Harris. I'll look into that for you and send you a DM today. Okay, so how to answer questions related to university. Firstly, make sure you read the course details. This is so, like, it upsets me how easy this is because there's so many situations where you'll go into an interview and be asked this like really basic question. What's a good decel? Good decel. You have to look at the university websites and see. I know some of them don't show, and I know it's really, really annoying, but that's the situation. I'd say in general, if you've got anything above like, if you've got anything like 6th or higher, I think that's pretty decent. But that's just my criteria. Bear in mind, I'm not an assessor, or I don't work for King's or anything, so I can't give you like official advice. But if you had to use any sort of measure, I'd say anything like 6th decile or above you should be okay, because that means that you're like in the top percentage of people in the country. Like you're better than average. Like that's what you should be aiming for, being better than average, and obviously much better if you're applying to King's or something, because they're more strict when it comes to it. And yeah, Amira just put the definition to compassion there. There you go, Harris. Thank you, Amira. And so here we go. So firstly, make sure you read the course details. These are really easy to find. Just go online and search them up. Like, you know, any university you're applying for, read the course details. So a lot of people just go and look at the entry requirements, but they actually talk about a lot of different things. They talk about what extracurriculars they want you to do, volunteering they want you to do, manual dexterity, like if they want you to, you know, really talk about that in your personal statement, etc., etc. When you're answering these questions, make sure you're clear and concise and show passion for the university. Bear in mind, all these questions are related to dentistry, but these university questions are university specific. So if you're talking about King's, you don't want to say, oh, I want to come to King's because, you know, I don't know, I really messed up. But you talk about things related to London, basically. You talk about things related to King's, you know, locally. You talk about Borough Market. You talk about the Shard. You talk about things that you find cool about that university. Maybe the teaching style, maybe if it's PBL. If anyone thinks PBL is good, well, you know, each to their own. Do I live at a student.com or at home? I live at home. So just really make sure that you understand and you read into these course details and get a good picture of the university. And another big thing is to read about research. Learn from my mistake. I went to an interview, got asked a question about research, and quoted research from another university. I've never seen a more angry interview in my life. So don't do the same. I did get the offer, so, you know, it wasn't too bad, but just bear in mind, like, you know, everyone makes mistakes. But yeah, like that's the situation I had. So I just thought I'd really emphasize it. If you want to find out research from these universities, literally go into their websites, go into like their recent news, stuff like that. You'll find some kind of research. And if you're really, 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 really stuck, go into like BDJ, ADA. So these are like the British Dental Journal, American Dental Association, and search up some articles. And you can talk about research in general. Like you can divert the question and be like, well, I'm not sure about research here. However, I have read into it, etc., etc., etc. What else? And yeah, really make the interviewer know that you've seriously considered this university. Maybe talk about some societies that you followed on Insta as well. That's another cool thing you can do, like Arab Sock at King's. And recognition of research shows that you have an inquisitive mind and you actually care about the university and you actually care about studying there. King's take this into account quite highly, because the reason why King's is ranked #1 isn't because like the teaching's the most amazing. It is decent, but it's mostly because of the fact that their research is fantastic. It is the best in the world. So if you can have a few things under your belt, then it can really show your passion for the subject. How long did it take for King's to give me an offer after an interview? I think a couple of days. My work experience is postponed due to COVID, but I don't have volunteering at all. Will Kings reject me for this? Interesting. Maybe. As I said, read your course details and you'll see. Another thing to do is to call up the university, explain the situation, because they might, because of the COVID situation, everything's a bit different this year. So call up and ask. That's another thing I'd recommend. If you have any questions, just call and ask. Like the staff there are quite friendly, and the admissions staff really do know what they're talking about. So do ask and see. When did you start preparing for interviews? So my school, like my sixth form, actually just did preparation throughout like year 13, like the beginning. So I'd say from November onwards. However, like serious prep was maybe a couple of weeks before my interview, like proper prep. But I was preparing from, let's say, like October onwards, like October, November onwards. And bear in mind, my first interview was in December, so it's good I did that because it was quite early. What is a good time to send your UCAS off as early as possible? What are the pros and cons of having such a big cohort at King's? I'll go into that at the end. Do KCL and Queen Mary consider SJT when it comes to shortlisting? No, I don't know. I did rubbish in my SJT. I got a band 3, and I got an interview. I got one of the first batch of interviews at King's. So I hope that answers your question. Of course, if you've done, like, if you get band 4, you'll probably not get into anyway. But I think band 3 is kind of like the cutoff. But yeah, to be honest, SJC section is not that difficult. But some people get bored and answer questions too quickly, which was me. So yeah, just make sure you answer it properly. If you do your UCAT now, what is the best way to prepare for interviews? Listen to this webinar. And also, yeah, I'm not being serious. And also just like trying to practice at home. So practicing with your parents and stuff. At the end of this, actually, I'll be going through like some different things that you guys can do to try and increase your practice. What was my UCAT score? My UCAT score was like 690, I think, 687, 690, something like that. So my UCAT score specifically was like 690 and band 3 SJT. That was my UCAT. Cool. Did you go on any interview courses? No, I did not. I personally don't think they're worth the money unless you're not really a very strong like speaker. Then interview courses might be the thing for you. However, I'd say like trying to just deal with different, see what your school is offering. And also, the one thing I did go to actually was there were some free events done by Queen Mary's by this society called SAMDA. So try and search them up. They do a lot of really good events. Some societies do free events as well, like for interview practice. Yeah, if you stay in contact on my Instagram and stuff, I might be trying to sort something out soon where I do a proper like interview course just online so you guys can practice. So stay up to date with that. But yeah, that's the best way to practice is just try to go over things with your family at home, look up questions, use the examples I've given, and yeah. Cool. So questions related to data and image analysis, these are quite common as well. I think I got asked one of these at each of my interviews, except for Queen Mary, obviously, because Queen Mary was a panel, but so like Bristol and King's. So in general, you need to take note of these keywords like describe, state, calculate, evaluate. They all mean very different things. Most of the mathematical questions are very easy. Don't worry. They won't ask you like this A level, differentiation question. Like they're quite simple maths. However, one of the skills that they are testing is to see your decision making. So in one of my interviews, I got given like 3 maths questions. One was quite complex in my eyes. It was complex, and the other 2 were very simple, but each one was worth the same number of marks. So you had to prioritize your time and see what you wanted to answer first and which ones you were going to answer. So obviously the hard one I left to the very end, but I managed to definitely secure 2 out of the 3 marks on the easy questions. So sometimes with these mathematical questions or these data analysis questions, they're not necessarily seeing if you can calculate it or seeing your mathematical ability. They're trying to see your decision making. So bear that in mind. And yeah, so I'm going to go through a describe a picture question right now. In general, with a describe question, it means that you say what you see. That is the best piece of advice I can say. If you can't see it on there, don't assume it. If you see that everyone is wearing really old clothes, don't say, oh, I think this painting was painted in the 1800s. Just don't infer. Just say exactly what you see. So be very clear. Can you ask for feedback at the end of the interviews? After, let's say you get rejected or accepted, you can ask them to send you like a breakdown of all your your scores if you really want to. Not specifically at the end of your interview, like the second you come out of the interview stage. No, you can't do that. It's not very professional in my opinion. You should wait till after you're finished, after they've dealt with all the information, processed it, and you've been told if you have an offer or don't, and then you can ask for feedback. So yeah, a few tips I would say for the answer a picture question is start from left to right or foreground to background, or do both. State any colors, notable objects, clothing, weather, etc. And think of it as if you're describing an image to a blind person. So this was actually one way they tried to visualize it to me in one of the exams. Is say, describe this image as if I were a blind person. So this is something that you could be asked in your exam. And don't infer anything. Again, say what you see. That's what describe means. Just describe what you see. People at a park. Yeah, there you go. Nice. You already got a mark. So yeah, so this is, okay, so I've kind of labeled this. This is like a model way to answer this question. So you could either go from left to right or foreground to background. So I'm going to go through this myself. So I could say from left to right, I can see a man lying here on the grass. He's wearing a cap. He's sitting in a group of 3. So now I've mentioned number. I've mentioned that it's a man. I've mentioned he's lying on the grass. I mentioned group of 3. Already in this one little, like tiny quadrant of this image, I've mentioned a million different things. Next, I can say he's wearing, I'm a bit colorblind, a brown top. He's under a shadow. There's a man behind him with a top hat who is holding a cane in his hand. There's also a woman with a slightly larger hat bonnet who's wearing a black dress. Behind them, there is a dog. Like, you see how it's very, like, it sounds really dumb, I know, but you just really need to be basic and straight to the point. So yeah, but you see how in like just that tiny section, I can talk about so much, so many things I can talk about. One thing you need to build up on is just that skill. So yeah, I can talk about the animals. I can talk about the people sitting. I can talk about the clothing they're wearing. I can talk about the park, the fact that it's near a lake. I can talk about that they're all holding umbrellas. There's so many things to talk about. And yeah, so I think I'm nearly done. So there, that was the main content of everything. I hope you guys found it all useful. Cloud in the sky. Yes, that's nice. Good. Water in the sea. Lovely. But at the same time, try and relate that to where in the image it is. So in the same way I said, moving from, you know, foreground to background. So you'd say, move from foreground to background, man sitting in a park. Then you'd say, I see some women by the water. On the water, there are some yachts. And in the sky, there are some clouds. So I'm moving upwards. Umbrella in shade. Yes. Big brain. Okay. Here are some useful links. Again, I'll be sending this out to you guys. Just in case you want to, you know, go over this in your own time. My socials are here as well. If you guys want to check them out, I think you will probably know them. And yeah, that's that really. Thank you all for listening. If you have any questions, please do ask me now.